Professor Kober, there was a report today about trying to intervene on patients with heart failure and Cheyne-Stokes respiration. Maybe if you could start by just saying a little bit about what role Cheyne-Stokes respiration plays in heart failure patients. How common is it? What kind of patients usually have this difficulty?
Yes, Cheyne-Stokes respiration is associated with the severity of the disease of heart failure. You normally don't find it in patients without heart failure, and the more the severe disease is, the more you find it. But you have to look for it because it's when the patients are asleep where we normally don't interact with the patients. But it goes along with the severity of the disease. It's not very common. It's hard to give figures because we're not looking for it all the time.
And this is a form of central sleep apnea?
Yes.
And you were telling me that's distinguished from obstructive sleep apnea, so maybe if you could just briefly talk about what the differences would be in those two types of sleep apneas.
Yes, central sleep apnea is actually driven from the brain, and it is like part of the disease, whereas obstructive sleep apnea, there's some mechanical obstruction when you're trying to breathe during sleep, and these patients quite often, but not always, snore and then have a terrible bad sleep. They wake up in the morning and feel like they haven't slept at all. So for them, it's very important to try to reduce the symptoms because they feel much better. So there it's a symptomatic treatment if you try to do that. In central sleep apnea, they don't have much of a symptomatic benefit if you try to treat it. But because it is so closely related to the prognosis, physicians and we have been thinking, well, could we try to help that, treat it, and would that change prognosis? And this is what the trial was all about. And it's a very well conducted trial, showing us, well, we were not quite understanding this because we treated central sleep apnea, but it didn't help the patients. It actually looked like it did some harm.
Yes. Actually, the showing the harm that was seen in the trial was both a surprise and a concern. And if you could talk a little bit about the way this treatment is now being used and what these results might mean for that.
Yes, one has to be cautious. We say that one swallow doesn't make a summer or something like that. That you have one trial showing this, so things might be different, but you have to be cautious extrapolating this to a lot of other patients, to a lot of other situations. But the treatment of central, it is possible to do, and it has been possible to do for several years. So physicians have started using it. So actually, by doing this trial, I think despite the harm they saw, and globally, they will probably reduce mortality because now we have to find out, we can't use it in these patients, it will be harm. So they have done a very good job doing this trial, despite that it didn't show what they hoped.
So do you think these results are going to change what's now being done in practice?
I think so, yes. And I also think we have to rethink our understanding of this.
And so, given especially the results of this trial and the dangers that it suggested, what would be, for the time being, the appropriate way to manage heart failure patients that manifest Cheyne-Stokes respiration?
Right now, I think the appropriate treatment is to give all the documented treatment that it has to be given to every heart failure patient with depressed left ventricular function. So this is medical therapy. We have 3 very efficient drugs. We have more drugs on its way that are devices. And I just think you have to use that and use it to the guideline tolerated doses.
And even if patients, you were telling me before that there are instances where a patient might go for a minute or 2 without breathing, you just kind of allow that to continue?
We don't know what to do.
Yes.
Which this trial tells us. So we need to think back, what are we going to do here?
Okay. Thank you very much, Professor Kober.
Welcome.